Welcome to our newest episode of the Lebanese Physicians Podcast. And today is the first time we do the podcast in person in Washington, D.C. at the George Washington University. Actually, that's where we're doing it today. And the title of our discussion will be discussing substance use in Lebanon and the MENA region, and discussing also mental health awareness in the region. My guests today are Rasha Abi Hana, who's a PhD student in Amsterdam. And she is in the clinical neuro and developmental psychology department. And she has a background in sciences, a master's degree in quality management, and a diploma in mental health policy and services. And she has experience actually working with the Ministry of Public Health in Lebanon on mental health awareness issues. And our second guest is Hala Najm, who actually currently is at Virginia Commonwealth University as a Fulbright scholar. She will tell us a bit more about it. Her background is a pharmacist, and she had earned a master's degree in public health from the American University of Beirut. Her interests are mainly in awareness about substance use disorders and prevention. And also we have with us Ziad Khatib, who is currently an associate professor in public health at the Karolinska Institute, and has a huge background in epidemiology and in communicable disease tracking in both developed and low and middle income countries in Africa. Welcome all of you to the podcast.
Thank you.
Thank you so much, Khalid.
Yeah, so this was such a big surprise. I was contacting Ziad to be a guest on the podcast, and then turns out he's in DC for a conference. And then he met Hala and Rasha at the conference, and we decided to do it in person for the first time. So welcome all over here.
Thank you.
First, I was going to ask Hala, you are into substance use awareness and prevention. So what's the definition of substance use? And do we call it substance use or substance abuse? Because you corrected me when I said substance abuse.
So the new terminology is substance use, because abuse shows stigma, and maybe Rasha can tell us more about the stigma and how it affects mental health. Substance use is a disorder. It's a chronic disease, and this is why it is a use. So and this is the change in science, actually, in the medical field, that it was viewed as behavior, and people used to stigmatize behavior, but now it's a disorder because it's a lifelong progressive chronic disorder of the brain. So this is the definition. It's an addiction. Substance use is a disorder, and it's an addiction to certain substances that are addictive, mainly like alcohol, tobacco, opioids, or pharmaceutical medications, and among others.
Yeah, which opioid is a big one in the US.
It's a huge one,
right? And that's interesting actually, because it's a disorder. Because a lot of times you get patients with substance use to the hospital, let's say, and you try to, or a lot of times, blame the patient for like not trying hard enough to get off their substance use. But I guess there's also a brain component to it, where it's very hard to get over this addiction.
Yes, it's definitely a brain disease.
Okay. And saying that, so do you know, because you were in Lebanon until recently, so can you tell me a bit about what you're doing here at VCU? Because I think you're here for a brief period of time right now on a Fulbright scholarship, and then you're moving back to the region in September.
That's right. So I'm here on a mission. It's a Fulbright scholarship, as you said, under the Hubert Humphrey Fellowship, which is for mid to senior career professionals. And at Virginia Commonwealth University, which is in Richmond, we focus on substance use prevention, treatment, and recovery. And what I have been doing here is develop my knowledge, my skills, even policy analysis related, and understanding what are the interventions, or exploring the different interventions that are being implemented here in the US, supporting the US system as well with my knowledge, because the US is marketed as if it's the best country in the world and the most advanced interventions are being implemented here, while a lot is lacking as well. There are so many resources that are also not being used effectively. And this was also my role. And I am currently now, I just got a job position with the Virginia Opioid Abatement Authority. And as you said, the opioid is a huge crisis here with the fentanyl crisis, which is very specific to the US. It's not a global crisis. It's an epidemic in the US. And there's so much funding that's being spent here on opioid. And I'm in my job as part of this fellowship, I'll be collecting a toolkit of evidence-based interventions so that cities and counties in rural areas actually make use of these interventions in an effective way. So the funding that's coming goes in the right direction rather than going into interventions that are not effective.
Exactly.
not evidence-based.
And in the right direction and the right place, I guess, because a lot of
Right.
these issues are in smaller towns and
Exactly.
cities.
It started in the
states.
opioid crisis started in Virginia in a rural area. This is where it started. And then and then it went up to the federal level. So it started in a rural area up to the federal level, and then the federal level down to the rural
Not the
areas.
rural area. And so, do you know, because you've also been in Lebanon before, do you know what's the incidence of substance use in Lebanon in general and in the youth in the country?
So I can tell you that it's increasing, and there's a study that's being done by a team of AUB professors on this matter. And in 2022, it's still under review. Between 2019 and 2020, and this is where the crisis started, there's an increase of 54% of cannabis use among adolescents aged 18 to 24 who are previous users, and the number for alcohol, tobacco, and pills are 32%, 70%, and 77%, respectively. This is by Dr. Ghandour, who's a specialist in mental health and substance use among adolescents at the American University of Beirut.
Yeah, I know Dr. Ghandour, she's a good friend of ours.
Oh, really?
Yeah.
Wonderful.
And she's been on the podcast before too.
Oh, okay.
Yeah, so it's mostly non-opioid substance use in Lebanon.
Yes, mainly in Lebanon, it's
Yeah.
still methamphetamines, alcohol. We have a lot of alcohol, a lot of marijuana, and now with this new marijuana incidents, and yeah, youth view marijuana differently these days, and we really need to look into this because it will become the next crisis, I would say.
Right, exactly. And any idea about like substance use in the MENA region, like in the Gulf countries or in the North African countries, or we don't have enough studies in these countries yet to.
Unfortunately, there are no studies, and because our culture doesn't allow us to say that substance use is a disorder, then there's a lot of keeping it in the shadow. So, and the governments don't like to say that our youth are using substances. So it's a struggle to actually get the information from governments. And we really definitely need a surveillance system, like the surveillance system that's here, so that like the DEA, for instance, or so on and so forth, that actually tracks the prevalence of substance use among youth. And throughout the conference, just to add this idea is that I really like this. Dr. Zili Sloboda said it. What is our most precious natural resource in your opinion? And it's our youth and children. In fact, in Lebanon and in the region, we have 30% of our population, if not more, are youth. So 30% are our natural resources, and these are the future. So if we don't take care of our natural resources, which are the youth and the children of tomorrow and our future, then there's something that's going to go wrong.
Right, exactly. And so Ziad, since you're here, I was going to ask you the question too, and maybe I don't know if you know the data in Europe on substance use in Europe. I know you work more in communicable diseases, but maybe you have some data.
I don't have the top of my head because I work more in prevention.
Yeah.
So I cannot answer.
You cannot answer the question.
That's more because I focus on prevention for people who haven't used substance yet.
Yep. So you're focusing on preventing the use of or substance use. We can talk about that in a bit, I guess. So what are some of the prevention measures that you tend to take to prevent substance use?
It's basically what Hannah mentioned regarding the youth, is that what are the different interventions that you can work with them to support them, and you don't talk actually about anything that has to do with drugs. Basically, you talk about resilience support and how communication skills, and these can become like protective factors for them, how to be they will be equipped with tools to be able to survive any life events, so then it will not lead them into substance use eventually, or stressful events and violence, which is kind of all packaged together.
I can add to what Ziad is also saying. So in prevention, there are different levels of prevention. The first level is working, as Ziad was saying, on the child and on the skills of the child, the life skills, and equipping them with the skills. And then you just have a few awareness sessions about drugs, alcohol, tobacco, because the adolescent's brain works differently. If you give them an idea, they would go and explore it because they're curious. This is how their brain works. So the less information you give them, they can find it online in all cases. So the less information you give them, the more skills you give them, is how the prevention works. So this is at the level of the personal level, and then you have the family-based interventions, which is also, so if you are equipping the child with, or the adolescent or the youth with the skills needed, and then he goes or she goes home and doesn't have the environment to actually apply this, or she's going home to a place that's not safe or so on, or there's no positive parenting, in other words, then there's no much use to the skills that you're giving at the school or at the personal level. And then you have the community-based interventions. So once you finish from the family, then you can work on the community. And these are a set of other interventions. And then you have the policy level interventions, which are related to alcohol and age, or not having alcohol or tobacco selling spots around schools or universities, and so on and so forth. So there are different levels of intervention, and nothing works as a silo. So if you silo one and you just you don't take it as a comprehensive approach, then it's less effective.
Yeah. So basically, the more interventions you add, the more effective.
Yes.
The prevention is going to be.
Exactly. Right. Yes.
And part of it probably is at the school level too, right? High schools and
obviously all age.
Yeah.
Prevention starts during pregnancy.
Yep.
It's not when you're 15 or 16. No, exactly. It's too late. It's never too late, but it's.
And Rasha, since you've worked at the Ministry of Public Health, so first, actually, can you tell us what your work has been in Lebanon, and then what you're doing now?
Yeah, so previously I was at the National Mental Health Program. I was the Service Development Coordinator. So I was more coordinating projects within the primary healthcare, within the hospitals, and we had also other services related to self-help, like an application that was developed by the Ministry of Public Health with WHO and other partners. So my work basically is to coordinate these projects to make sure it's according to evidence-based. We had some monitoring and evaluation indicators to make sure that this was delivered to the people in need, as well as other capacity building program for nurses and general practitioners, because we were trying to integrate mental health within the general health facilities, including primary health care and hospitals. So this was part of my work within the ministry. Now I'm working with an organization, actually remotely from Lebanon. The name of the organization is ISAP, the International Society of Substance Use Professionals. My work is within the scientific department, so I make sure that like the latest research are on our website. We review the webinars, like we do networking for people working within the substance use field. And like we make sure that like everything is evidence-based. We have certain quality practices and policy and like ethical practices that are ongoing.
So basically you're trying to push for policy change within the Ministry of Public Health in Lebanon, right?
Yeah, this was the project, like the mandate of the National Mental Health Program. This was like based on a strategy by the Ministry of Public Health. So the Ministry of Public Health issued actually two strategies. One is for mental health, and the other one is for substance use professionals or substance use in general. It's called interministerial strategy. And this one was done with the Ministry of Justice, Ministry of Higher Education, and MOSA, Ministry of Social Affairs.
Okay. And so what have the outcomes been so far? Like, have there been any laws implemented, or have there been any tangible prevention measures implemented by the government for this, or is it more on a NGO level or on a society level?
Yeah. Actually, the work of the National Mental Health Program was really to make sure that there is this collaboration between the NGOs, because NGOs are receiving funding for projects, and the ministry will make sure that there are no parallel systems or parallel projects that can affect the end outcome of giving the service for everyone. So mainly it was to coordinate the work. And just to answer your question about like the strategy has different domains. One of them is leadership and governance. It's more about the law. The second one is about the reorientation of the services, where I just talked about the integration of mental health within the other healthcare facilities. The third one is about media and prevention. So also the National Mental Health Program was working towards like increasing awareness and like putting advertising about stigma related to mental health or substance use. So this is the third domain. The fourth domain is regarding health information system. So also the ministry was working to establish a platform where everything will be automated and like linked to the ministry. And the fifth domain was for vulnerable groups. Vulnerable groups including pregnant women, including people who have missed persons that we don't know what are they're like, where are they?
Yeah, especially during the war.
Yeah,
Yes.
exactly. So this one is for vulnerable people, including also LGBT, refugees, and other vulnerable population. So this is the domains, and like the ministry was working towards different domains. And I can tell you a little bit about the law related to substance use if you want.
Yes, we'll talk about it. And so Ziad, I'm going to ask you about this question, but Ziad, are these prevention measures similar to what's happening in Europe right now in terms of prevention?
Yeah, absolutely. So in Europe, they focus a lot on what is called the environmental policies. So, for example, when it comes to schools, how you can prevent, make sure that you have an environment that's clear from crime, let's say, around the school environment, or nightclubs, nightlife, how you can ensure having quite good control around them. So this is the environmental policies. And inside the schools as well, what type of programs you can have for the children during this age, like early age, which is like 6 and 9 years old. So there are different programs, and every environment has a different type of intervention is needed. So indeed, when you have it as a holistic approach, this is where you can have good strategies. But I mean, Europe, many countries, and every country, they can have also different policies. It depends on the municipalities.
Right.
There's a lot of variation, of course. So it's hard to tell like the whole Europe.
Right. Similar to the US, I guess, because you're also you've got different states, and each state has its own separate policies, or each county has its own separate policy. That is correct. And so so now let's talk about the law. So how have the laws changed yet, or are there plans to implement changes to the law?
Yeah, so the use of narcotics and psychoactive drugs without medical prescription is classified as a crime in Lebanon, with an imprisonment sanction varying between 3 months to 3 years.
In Rumi prison?
No more spaces there.
Yeah, best case scenario actually is Rumi prison. For the drug law, actually, in 1998, it provides the person arrested or prosecuted for drug use with the option to be referred to a ministerial committee. So it's called the Drug Addiction Committee. It has the authority to offer the person the option for treatment. So if someone wants to be treated instead of to be in jail, he can, he has the right to do so. And the other law that I could tell you about is in 2010, the MOPH issued the decision 849 for the safe organization and provision of OST. So these are mainly the laws that, as you see in like the last one was in 1998, and this considered like a bit not updated. So now like the National Mental Health Program is trying to update the law according also to its strategy. But like in Lebanon, the law will take
Yes.
But especially now, it's going to take
Another
a long
2
time to
decades.
So
get implemented.
there is like a draft law that is within the parliament, but for now, like it's not issued.
And Hala, are you involved in these efforts?
I'm not involved in advocacy for a law. I'm more
Yeah.
into substance use prevention among children, adolescents, and young adults. But I am definitely in the loop of what's happening. So, but considering that the first law that Rasha mentioned was issued in 1998, this shows that Lebanon was an advanced country back then. And then we were discussing before coming that in 2020, if I'm not mistaken, there was a circular that was sent out to judges, just reminding them that there was a law in 1998 that gave the right for people who are using drugs to choose treatment rather than being incarcerated, because it was not being implemented in 2020. So in the 20th century, it was not being, 21st century, it was not being implemented. So this also shows that Lebanon is going, unfortunately, spiraling downwards. It's still spiraling downward, and this is affecting the increase in substance use among the next generation as well, which is sad. But again, the National Mental Health Program has been doing a great job in trying to put these efforts together, put the funding together, and trying to make things more structured and avoid the duplication. And Rasha was also mentioning about the OST, which is the opioid substitute therapy, which is the treatment for people who are using drugs, and it is under the control of the National Mental Health Program. So there are measures that are being taken, and there is an intention for a lot of efforts to be done. But with the political instability that we have and the economic instability, it's really hard to keep things moving the way we want them to move.
Yeah, because a lot of it is more like individual efforts or NGO efforts to improve things, but there's a lot of dysfunction at the government level that does not allow this to happen.
There are higher priorities. So let me tell you an example of this. So we as the organization I work for, Mentor Arabia Foundation, which is a regional organization, we're trying to work on a prevention program for schools with the Ministry of Education in Lebanon. And then COVID happened. So their priorities definitely shifted from prevention, which is development of their skills, to education and trying to figure out how to educate, like the basic education of children. So the priorities are shifting, especially with the economic crisis and with the Lebanese lira's depreciation rate. And I guess you know that employees are not very enthusiastic about going to work, especially public employees.
Exactly.
So that's also another thing to consider. So it's a vicious cycle that we're into. That some people want to work, but then there are so many obstacles that are affecting that.
Right. And shifting just slightly to mental health awareness, which is the other topic that you've been working on, Rasha. So how is mental health awareness in Lebanon now, and what's being done to improve it? Because I think a lot of people, probably it's better now, but a lot of people don't like to go, let's see a psychologist, because they're afraid of the stigma of what's that going to cost for them. And also they may not have the money to see them. So
yes, that's right. Actually, what you need to do in this regard is not really a one level action. So you need to target many levels. Starting by the law, again, you need to renew the law or update the law because it's really outdated regarding, for example, involuntary hospitalization. So people can take or carers can take anyone from their family to a hospital without their consent, and this is approved by law, and they can keep this person forever in the hospital. So we need to start by the law. We need also to do the awareness, as you said. So the awareness should be for the general public, should be for the doctors and the nurses, and also for psychologists and psychiatrists. The other level is regarding self-help techniques and self-help awareness, because the stigma starts really from the self. So if we want to focus more on stigma or talk more about stigma, there are embedded levels of stigma, starting by self-stigmatization. So the person will feel, oh, if I go to the psychiatrist or the psychologist, they will say I'm crazy. If my family knows about it, also they will do some pressure, or they will discriminate me. So it starts with the self, and then there is the family stigma, where family doesn't help like the person to go and seek help. They just hide the condition of the person. And in one of the projects I was doing for my PhD, I did many interviews with patients. So one of the women I interviewed, she said, I don't want my husband to know that I'm taking medication because he may divorce me, he may leave me. Another one said that her brother, when he knew that she was taking medicine, he threw the medication from the window. So here you see, like, there are no support from the family. So this is the second level. The third level is the community, and also the organization, for example, the primary healthcare center or the hospital. So we also interviewed nurses and general practitioners who said, like, they don't want to cooperate with those violent patients. So they see them as violent. They don't want really to screen for mental health disorder. And this is where the ministry was doing a lot of training for nurses and doctors. And the third level is the structural organization, where the law will not help the person also to seek help or to give them the rights. So it's like also 4 levels that needed to be tackled. And this is where, like, this is part of my first paper about stigma, where I explained what are the interventions that needed for every level.
Exactly. Yeah, so stigma is a big thing, I think, in the whole Middle East region, not only in Lebanon. But do you see that stigma in Europe?
I think stigma is like a problem for some, usually for humanity in general, especially when it is for something that people don't see. Like, I have worked in several topics, and what I have seen is that when people like see blood, they feel more sympathy or broken bone. And when it's something that you just described, there is some stigma around it because people don't see it. They have certain thoughts about it somehow. And I think this is where the role of education comes in, to have more understanding to what the patient goes.
Right, exactly.
Yeah. And just to add to an example to what you said, so if you see someone who has a broken hand, you will not say, you're okay, don't worry about it, you will be fine. However, sometimes people tend to say to other, like, people with depression or people with anxiety, you're fine, nothing is going on, and this is all on in your head. So yeah, this is exactly what we are, like, seeing in the community.
Yeah, similar to what Hala was saying, I think, about substance use too, because you tend to say it's your fault and it's in your head, but it's also, I mean, the brain is an organ too, and it's like the heart, like the lungs can be damaged too, and it's the same thing, I think.
You don't see a broken bone. You can see a broken bone, but you cannot see a broken brain.
Right, you cannot see a broken brain. That's why
that's stigma.
More,
that's
exactly.
Stigma.
That's the stigma about it.
And it's about behavior. Stigma is about behavior and shaping the behavior. And there's also normalization of a certain behavior and not another. So what Lebanon is trying to do, at least from the efforts, is trying to normalize mental health, that it's part of your health. Physical and mental health are the same. They are equal. They are equivalent. You have the same way you check for your physical health, and then you go to the general physician or whoever, family physician, for tests, blood tests. You also have to check for mental health. And you were asking Ziad about stigma in Europe, but I can say here in the US, and I've seen it, that there's so much stigma around mental health. There's so much stigma around substance use as well here in the US. And I was really surprised to see that, because this is not how we see it from our lens in the Middle East. We see that the Western world is more advanced in this. But in fact, it's not really the case.
Yeah.
Unfortunately.
Yeah, I agree.
So it is a global issue. Stigma is a global issue.
Yeah, I think it's probably the Western world is more advanced. Just one thing, maybe that there's more laws, maybe that tend to protect individuals,
Exactly.
but the stigma is still there.
Exactly.
Right.
I totally agree with you.
And so, Rasha, you're currently now in Amsterdam, and you were here at GW, I guess, for 6 weeks, and now you're leaving next week, I think. Yeah. And we just met today. But so, what were you doing here at GW?
Yeah, so I'm a visiting researcher to the Center of Global Mental Health Equity at GW School of Medicine and Health Sciences. I'm working with Professor Brandon Court on the implementation of anti-stigma interventions in a global context. And this was part of a grant that I received from Vrije Universiteit from Amsterdam. So they are helping students to go abroad and visit researchers and to learn about a certain topic. So I submitted a proposal to come here to GW, and it was accepted. And therefore, I've been here for 6 weeks, as you said. I worked on the outline of my paper. It should be my last paper for my PhD, hopefully. And we'll continue the work when I'm back to Lebanon.
So when are you moving back to Lebanon?
Actually, this Saturday, it's tomorrow.
Okay.
I'm just trying not to think about it.
And so you're gonna move back to Lebanon and continue your job with the Ministry of Public Health there, and
so I'm just continuing my work on my PhD and my interviews with the National Mental Health Program. But currently, I'm working with an organization in London. So I'm not really affiliated for the ministry anymore. Okay. 2 years ago, I left my position. But we're working still on some of my PhD projects regarding stigma, mental health, and other topics.
And so you will continue, once you go back there, you'll continue the work on advocating for...
Of course, yeah.
And now you've done your PhD, so you have more data to...
Exactly. This is I think it's my passion. It's something I really enjoy to do, and I'm learning a lot, even with interviews with patients. That has been really life-changing for me.
And Hala, what are your plans after VCU?
So the program ends in a week, but I'm extending my stay here because, as I mentioned, I have a job with the Virginia Opioid Abatement Authority. I'll be back in Beirut in October, hopefully. I plan to have a new position in the organization I work for, hopefully, and to spread the awareness on prevention sciences, because there's a lot of efforts in the region and a lot of funds in the region that are being put into prevention, but not all of them are evidence-based. And if they're not evidence-based, this means that they are less effective. And if they're less effective, then we have funding that is going down the line without really being effective with our youth. So I plan to expand this field, prevention field, in the MENA region, and have more youth engaged in prevention sciences, maybe affiliated with universities here in the US in general, because I've met a lot of professionals throughout this year. And unfortunately, the main question that I had, why don't you work in the Middle East and North African region? And their answer was consistent among different organizations, be it universities, be it governmental entities. We don't have a focal point in the Middle East and North African region. So hopefully Mental Arabia or myself, or however that goes in the future, will be the focal point for Western entities to be working in the Middle East and North African region to expand this field and make it a more prominent field.
Exactly, because there's a lot of evidence-based interventions in the Western world, but that doesn't mean it translates, especially in mental health, exactly to different cultures. So it's important to get evidence-based data. And
it's not only about the culture; it's about the intra-culture. even in Lebanon, let's be realistic. What works in the south doesn't work in the north, or doesn't work in Mount Lebanon, and doesn't work in the Bekaa region.
Right.
So each area has its own specifics, its context. So how about different regions or different areas, knowing the MENA region and its diversity?
Exactly. What works in Lebanon even probably does not work in Syria or does not work in Jordan, which are the
All
closest
programs
countries to
are
Lebanon.
adapted. All programs that we implement as an organization must be adapted to the context. Even for children, the examples, for instance, in Palestine, are not about a small girl playing or with a toy or something. They're about a boy probably throwing stones, for instance, when we are talking about violence. So the examples change, the concepts remain the same. So there is fidelity to the intervention. Definitely, there's always fidelity to the intervention, the evidence-based practices, but there will always be an adaptation to the cultural context that we're working in.
Right. Exactly. And Ziad, what are your you already have plans, I guess.
Well, I'm in the global health arena,
Right.
and my passion has been different topics. And right now, I really try to play a role as a catalyst in terms of how to help and support others. And I believe every person has a gem inside, and how to unlock these gems to contribute for the betterment of the world. So I work in different topics, really. So I don't have a particular plan, but once you get into the academia, you start to think about different things. But the part of substance use prevention, I think it's very important, because once you work with the children, this is the future society, and they are very important. This is the foundation of the society.
Are you involved in any projects in Lebanon or?
No, because I have been away from Lebanon for a while.
Okay, yeah, thanks to all of you for coming. And Hala and Rasha, your work is very inspiring, and also it's inspiring. Like you both have families, and you're doing your PhDs, you're doing your projects, and you're trying to improve actually the level of knowledge that you have to help in the region, and that's very inspiring to everyone. And Ziad, thank you for introducing us to Hala and Rasha.
Yes, especially thank you to Ziad for actually insisting on doing this three-way podcast. So thank you so much, Ziad, for your support all throughout. I mean, we also met Ziad throughout the conference.
Yeah, that's what you were saying.
So just interesting. The four of us just met, and then we're here on a podcast.
Yeah, exactly.
Yeah. Actually, like both of you, like I feel overwhelmed with the support when I see any Lebanese outside Lebanon. And this is very inspiring also to see you like succeeding with all the challenges, with all sometimes the stigma towards Middle Eastern, like working outside the region. So yeah.
But we need you back home. So please come back home. We need some support. We can.
I went back, I came back, so I've done my share. No, but but I think also Lebanon like leads to, I think just the way Lebanon is, it leads to resilience, right? Like you're always trying to find your way or navigate your way in multiple things. So when Lebanese like leave the country, they're very adaptable. That could be one of the things
they're well equipped.
They're well equipped, exactly.
With the skills to
All right, thanks to all of you.
Thank you.
Thank you very much.
Thank you.